Hydroxychloroquine, sold under the brand name Plaquenil among others, is a medication used to prevent and treat malaria in areas where malaria remains sensitive to chloroquine. Other uses include treatment of rheumatoid arthritis, lupus, and porphyria cutanea tarda. It is taken by mouth. It is also being studied as an experimental treatment for coronavirus disease 2019. Common side effects include vomiting, headache, changes in vision, and muscle weakness. Severe side effects may include allergic reactions. Although all risk cannot be excluded, it remains a treatment for rheumatic disease during pregnancy. Hydroxychloroquine is in the anti-malarial and 4-aminoquinoline families of medication. Hydroxychloroquine was approved for medical use in the United States in 1955. It is on the World Health Organization's list of essential medicines, the safest and most effective medicines needed in a health system. In 2017, it was the 128th most prescribed medication in the United States, with more than 5 million prescriptions. Medical use. Hydroxychloroquine is used to treat systemic lupus erythematosus, rheumatic disorders like rheumatoid arthritis, porphyria cutanea tarda, and Q fever, and certain types of malaria. It is considered the first-line treatment for systemic lupus erythematosus. Certain types of malaria, resistant strains, and complicated cases require different or additional medication. It is widely used to treat primary Sjögren syndrome, but has not been shown to be effective. Hydroxychloroquine is widely used in the treatment of post-Lyme arthritis. It may have both an anti-spirochete activity and an anti-inflammatory activity, similar to the treatment of rheumatoid arthritis. Contraindications. The drug label advises that hydroxychloroquine should not be prescribed to individuals with known hypersensitivity to 4-aminoquinoline compounds. There are a range of other contraindications, and caution is required if patients have certain heart conditions, diabetes, psoriasis, etc. Side effects. The most common adverse effects are mild nausea and occasional stomach cramps with mild diarrhea. The most serious adverse effects affect the eye, with dose-related retinopathy as a concern even after hydroxychloroquine use is discontinued. For short-term treatment of acute malaria, adverse effects can include abdominal cramps, diarrhea, heart problems, reduced appetite, headache, nausea, and vomiting. For prolonged treatment of lupus or rheumatoid arthritis, adverse effects include the acute symptoms, plus altered eye pigmentation, acne, anemia, bleaching of hair, blisters in mouth and eyes, blood disorders, convulsions, vision difficulties, diminished reflexes, emotional changes, excessive coloring of the skin, hearing loss, hives, itching, liver problems or liver failure, loss of hair, muscle paralysis, weakness or atrophy, nightmares, psoriasis, reading difficulties, tinnitus, skin inflammation and scaling, skin rash, vertigo, weight loss, and occasionally urinary incontinence. Hydroxychloroquine can worsen existing cases of both psoriasis and porphyria. Children may be especially vulnerable to developing adverse effects from hydroxychloroquine. Eyes. One of the most serious side effects is retinopathy. People taking 400 mg of hydroxychloroquine or less per day generally have a negligible risk of macular toxicity, whereas the risk begins to go up when a person takes the medication over 5 years or has a cumulative dose of more than 1,000 grams. The daily safe maximum dose for eye toxicity can be computed from one's height and weight using this calculator. Cumulative doses can also be calculated from this calculator. Macular toxicity is related to the total cumulative dose rather than the daily dose. Regular eye screening, even in the absence of visual symptoms, is recommended to begin when either of these risk factors occurs. Toxicity from hydroxychloroquine may be seen in two distinct areas of the eye, the cornea and the macula. The cornea may become affected by an innocuous cornea verticillata or vortex keratopathy and is characterized by whorl-like corneal epithelial deposits. These changes bear no relationship to dosage and are usually reversible on cessation of hydroxychloroquine. The macular changes are potentially serious. Advanced retinopathy is characterized by reduction of visual acuity and a bull's-eye macular lesion which is absent in early involvement. Overdose. Due to rapid absorption, symptoms of overdose can occur within a half an hour after ingestion. Overdose symptoms include convulsions, drowsiness, headache, heart problems or heart failure, difficulty breathing and vision problems. Hydroxychloroquine overdoses are rarely reported, with 7 previous cases found in the English medical literature. In one such case, a 16-year-old girl who had ingested a handful of hydroxychloroquine 200 mg presented with tachycardia, hypotension, central nervous system depression, conduction defects, and hypokalemia. Treatment consisted of fluid boluses and dopamine, oxygen, and potassium supplementation. The presence of hydroxychloroquine was confirmed through toxicologic tests. The patient's hypotension resolved within 4.5 hours, serum potassium stabilized in 24 hours, and tachycardia gradually decreased over 3 days. Interactions: the drug transfers into breast milk and should be used with care by pregnant or nursing mothers. Care should be taken if combined with medication altering liver function as well as erythropoiesis, cimetidine or digoxin. HCQ can increase plasma concentrations of penicillamine, which may contribute to the development of severe side effects. It enhances hypoglycemic effects of insulin and oral hypoglycemic agents. Dose altering is recommended to prevent profound hypoglycemia. Antacids may decrease the absorption of HCQ. Both neostigmine and pyridostigmine antagonize the action of hydroxychloroquine. While there may be a link between hydroxychloroquine and hemolytic anemia in those with glucose 6-phosphate dehydrogenase deficiency, this risk may be low in those of African descent. Specifically, the FDA drug label for hydroxychloroquine lists the following drug interactions. Digoxin, wherein it may result in increased serum digoxin levels. Insulin or anti-diabetic drugs, wherein it may enhance the effects of a hypoglycemic treatment. Drugs that prolong QT interval and other arrhythmogenic drugs, as hydroxychloroquine prolongs the QT interval and may increase the risk of inducing ventricular arrhythmias if used concurrently. Mefloquine and other drugs known to lower the convulsive threshold. Co-administration with other antimalarials known to lower the convulsion threshold may increase risk of convulsions. Antiepileptics, concurrent use may impair the antiepileptic activity. Methotrexate, combined use is unstudied and may increase the frequency of side effects. Cyclosporin, wherein an increased plasma cyclosporin level was reported when used together. Pharmacology. Pharmacokinetics. Hydroxychloroquine has similar pharmacokinetics to chloroquine, with rapid gastrointestinal absorption and elimination by the kidneys. Cytochrome P450 enzymes metabolize hydroxychloroquine to N-desethyl hydroxychloroquine. Pharmacodynamics: antimalarials are lipophilic weak bases and easily pass plasma membranes. The free base form accumulates in lysosomes and is then protonated, resulting in concentrations within lysosomes up to 1,000 times higher than in culture media. This increases the pH of the lysosome from 4 to 6. Alteration in pH causes inhibition of lysosomal acidic proteases, causing a diminished proteolysis effect. Higher pH within lysosomes causes decreased intracellular processing, glycosylation and secretion of proteins, with many immunologic and non-immunologic consequences. These effects are believed to be the cause of a decreased immune cell functioning such as chemotaxis, phagocytosis and superoxide production by neutrophils. HCQ is a weak diprotic base that can pass through the lipid cell membrane and preferentially concentrate in acidic cytoplasmic vesicles. The higher pH of these vesicles and macrophages or other antigen-presenting cells limits the association of autoantigenic peptides with class II MHC molecules in the compartment for peptide loading and/or the subsequent processing and transport of the peptide MHC complex to the cell membrane. Mechanism of action. Hydroxychloroquine increases lysosomal pH in antigen-presenting cells. In inflammatory conditions, it blocks toll-like receptors on plasmacytoid dendritic cells. Toll-like receptor 9, which recognizes DNA-containing immune complexes, leads to the production of interferon and causes the dendritic cells to mature and present antigen to T cells. Hydroxychloroquine, by decreasing TLR signaling, reduces the activation of dendritic cells and the inflammatory process. In 2003, a novel mechanism was described wherein hydroxychloroquine inhibits stimulation of the toll-like receptor 9 family receptors. TLRs are cellular receptors for microbial products that induce inflammatory responses through activation of the innate immune system. As with other quinoline antimalarial drugs, the antimalarial mechanism of action of quinine has not been fully resolved. The The most accepted model is based on hydroxychloroquine and involves the inhibition of hemazoan biocrystallization, which facilitates the aggregation of cytotoxic heme. Free cytotoxic heme accumulates in the parasites, causing their deaths. Society and culture. Cost. The wholesale cost in the developing world was about $4.65 per month as of 2015, when used for rheumatoid arthritis or lupus. In the United States, the wholesale cost of a month of treatment is about $25 as of 2020. In the United Kingdom, this dose costs the National Health Service about £5.15. Brand names. It is frequently sold as a sulfate salt known as hydroxychloroquine sulfate. 200 mg of the sulfate salt is equal to 155 mg of the base. Brand names of hydroxychloroquine include Plaquenil, Hydroquine, Axmal, Dolquine, Quensil, Quinaric. Regulatory approval. On March 17, 2020, the AFA, also known as the Italian Medicines Agency, Scientific Technical Commission of the Italian Medicines Agency, expressed a favorable opinion on including the off-label use of chloroquine and hydroxychloroquine for the treatment of COVID-19. In the U.S., several state pharmacy boards reported that some doctors and dentists were writing prescriptions for hydroxychloroquine and a related drug, chloroquine, to themselves, family members, and staff. Sudden demand spikes caused by hospital use for severely ill COVID-19 patients and prescriptions for prophylaxis have resulted in shortages. Doctors have expressed concern that patients who have long taken hydroxychloroquine for other approved indications, like lupus and rheumatoid arthritis, will be unable to procure needed medicine. On March 28, 2020, the U.S. Food and Drug Administration issued an emergency use authorization to allow hydroxychloroquine sulfate and chloroquine phosphate products donated to the Strategic National Stockpile to be distributed and used for certain people who are hospitalized with COVID-19. Research. COVID-19. Hydroxychloroquine is being studied as an experimental treatment for coronavirus disease 2019. As of March 23, the benefits versus harms of treatment with hydroxychloroquine are unclear. Some are also using it off-label for the disease.